Hello. This brief presentation will give you some information about what you can expect from the upcoming Joint Commission survey. We'll also talk about what we're doing to get ready and what role you can play when inspectors are on site. The Joint Commission survey is a terrific opportunity to showcase the great work that you do every day. While some people feel nervous about speaking with surveyors, let's remember that we all want the same thing: excellent care for the patients and families we serve. The Joint Commission, also known as TJC, has a big job. It evaluates over 20,000 healthcare organizations, sets standards of care, and accredits organizations who meet these standards. The great majority of these standards, by the way, relate to patient safety. They want to know what we're doing to protect patients and clients from infection, further injury, and the steps we take to protect their privacy. They're also interested in how we protect ourselves from injuries and infections. Here's their mission statement: to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Sounds good, right? We want that too. So let's look at how we demonstrate safe and effective care and promote best practice when inspectors are on site. When surveyors arrive on site, you may hear an announcement that we are welcoming Joint Commission surveyors. Take this opportunity to do a visual sweep of your area, check for expired materials, and be sure that hallways are free of clutter and hazards. If you're selected to have Joint Commission surveyors ride along with you, they may check your trunk supplies to ensure that nothing's out of date. So please check these items now to be sure you're ready. When surveyors are asking you a question, be concise and answer only what's being asked. Remember that you always have access to the Vital Documents folder on your computer, where you can find policies as well as critical information sheet with many of the topics that the Joint Commission will often ask. Check these resources now to be sure that you can access them when you need to. What if the surveyor is asking you a question and you don't know the answer? Or what if they scrutinize your documentation? Remember that this is not intended as a personal attack, so there's no need to blame a coworker. They're looking at the entire organization, and you just happen to be the face of the organization that's sitting in front of them. Remember the National Patient Safety Goals. They want to know that our processes are in place to ensure that we're providing safe and effective care. And be sure to do your hand hygiene, good bag technique, and review the patient's plan of care. Documentation should be completed at the time of visit. And here's some answers you can use if you're not sure how to handle a question. The surveyor asks, how would you handle a particular situation, and you're not sure? You can say, in that situation, I would get in touch with my supervisor for guidance. Or they ask you about the organization's policy for X, Y, and Z, and you're not sure. You can say, I know right where to find the policy if I need to look something up. And for a procedure, I can find additional information in our Lippincott procedure manual. And now the surveyor knows that the policy would be followed and we would come up with the right conclusion. One of the hot topics that surveyors will be looking at is infection control. You may be asked, what materials do you use to sanitize surfaces? And how long must the disinfectant solution remain on the surface to be effective? In other words, the surface would be wet with the solution for how many seconds? Now's the time to check the materials you're using and learn the answers. They may ask whether you've received training on the symptoms of COVID-19, donning and doffing of PPE, and whether you've been given regular updates. Fortunately, we've had access to our expert physicians and infection control leaders during our weekly call-in meetings, and we also educate families on COVID-19. Please be sure you're documenting in the chart that you provided that education. For our care planning, surveyors may want to know how we decide whether it's appropriate to use telehealth to conduct visits for a particular patient. And the answer is that this decision is based on whether telehealth will meet the identified needs of the patient. And if you're asked how often the care plan is reviewed or revised, the answer, of course, is that it's updated as often as the patient condition requires. And of course, it's reviewed and revised at IDGs, at least every 15 days. Other hot topics for the Joint Commission are oxygen administration and medication management. If oxygen is ordered, it must be on the med list. Liter flow on the SN6 must match the ordered flow. And we should have an intervention listed in the record for patient family education and safe storage of oxygen cylinders. For medication management, we need to be focused on doing good med reconciliation and ensuring that Delta Care matches what's in the EMR as well as the facility MAR. And if you're not going out to the facility, ask them to send you the MAR as well as any new orders so that we can ensure our records are correct. When we have surveyors with us, just remember that they want the same thing we do, excellent care. They have busy schedules just like we do. They've probably been on the road. Give them a smile and be ready to show them that we are fully engaged in the excellent care that we provide. Please ask your supervisor if you have any questions. Thank you for your time and feel free to contact us for more information.